Today we are discussing about some of the give reasons from elderly. The first 5 questions are from cardiology. So the first question is elderly patients commonly have increased systolic BP. What is the reason? It's nothing but it is due to loss of arterial elasticity. The second question is older adults often develops irregular heart rhythm. Why? Is due to reduction in the pacemaker cells. The third question is elderly are more prone to heart failure is due to reduced cardiac contractility. So the fourth question is elderly often shows S4 heart sound, abnormal heart sounds. Why? It's due to stiff ventricles. The last question is older adults may feel fatigue during mild activity. What is the reason behind this? It's nothing but it is due to decreased cardiac output. The next key area we are focusing is respiratory system. The first question is elderly are at high risk for pneumonia. What is the reason? It's nothing but the weak cough reflex and decreased ciliary action. The second question is older adults experience shortness of breath on exertion. Is nothing but it is due to decreased alveolar surface area and decreased lung elasticity. The third question is oxygen saturation may be slightly lower in older adults. Why? It's nothing but reduced alveolar surface area. The fourth question is elderly are encouraged to perform deep breathing exercise. Why? It's nothing but chest wall rigidity and weak respiratory muscle. The next focusing area is neurological system. The first question is elderly requires extra time to learn new tasks. Is truly is because of slower cognitive processing speed. The second question is older adults may have impaired temperature regulation or thermoregulation is due to reduced hypothalamic function and decreased subcutaneous fat. The third question older adults have slow response time is because they have decreased nerve conduction velocity. The last question is the sudden confusion in elderly is not normal aging process. So most important give reason and one of the most important concentrating point is the during the normal aging process the sudden confusion will not occur. It's indicate delirium often due to infections like UTI or any medication or due to decreased oxygen supply. The next area we are focusing is renal or genitourinary system. The first question is the drug dose are reduced in older adults. So when the doctor prescribe the medicines, so the low dose is advised for older adults. Why? Is due to reduced kidney filtration and liver metabolism. The second question is older men may have urinary retention, not female, only the men. Is due to prostate enlargement, that is called it as BPH, benign prostatic hyperplasia. The third question elderly have high risk of drug toxicity. Why? Is they have reduced kidney filtration, that's why they have drug risk for drug toxicity. Elderly have noturia. Noturia means nighttime urination because reduced ability to concentrate urine. The fifth question older women are prone to recurrent urinary tract infection UTI is because decreased estrogen levels and incomplete bladder emptying secondary to decreased muscle function. Next area we are focusing is gastrointestinal system. The first and most important question is constipation is most common in elderly is due to decreased intestinal motility. The second question older adults may have experienced indigestion and bloating is due to decreased gastric emptying. and decreased digestive enzymes. The third question, vitamin B12 deficiency is common in elderly, is due to reduced intrinsic factor and gastric acid secretions. The fourth question is elderly are more prone to drug toxicity, that we already discussed in the previous slide. Elderly often have loss of appetite, is due to decreased taste and smell sensation. Some questions from musculoskeletal system too. The first question is risk of bone fracture increases in elderly. Is most relevant, most appropriate questions from this system. Is due to decreased bone mineral density. So the bone mineral density means decreased bone mass. That condition is called it as osteoporosis. One of the main etiological factor for osteoporosis is female gender, secondary to decreased estrogen level. Second question is older adults may have slow walking and balance problem. That is also a relevant question, is due to loss of muscle mass and decreased proprioception. Proprioception is the awareness of position and movement of parts of the body without looking at them. Means it help the person to know where your limb are, how they are moving, and how much force your muscle are using for this movement. These kind of things are comes under proprioception. The last question is pressure ulcer risk increases elderly. It's very relevant question, and most of the student nurses or nurses are facing this problem while handling elderly persons. Is due to reduced skin perfusion and also mobility.